Okay, so because this is, these procedures do require a doctor's order, we're going to get all our equipment together and we're going to verify the doctor's orders. So we've got doctor's orders for tap water enema of 750 milliliters, okay? And then we've got doctor's orders for placing a bilateral thigh-high TED hose. So because we're going to be doing an enema, we anticipate splash. We don't want to get this on our clothing and take it from patient to patient, so we are going to need PPE. Next week, y'all will do like we did before to save time to make sure we get through to everybody. You will just verbalize the order that you will put your PPE on. I would suggest that you bring gloves, and that will remind you, okay, to go ahead and put your PPE on, but you will verbalize putting it on and taking it off in the right place. Today, I'm going to go ahead and put it on where it is required, okay? So PPE, we anticipate splash, so what are we going to use? A gown, mask, gloves, protective eyewear. We're gonna utilize all of our protective equipment. So I've got all of that right here. And we've got everything together, so we're going to go down the hall to Mrs. Bell's room. Good morning, ma'am. My name is Angie. I'm going to be your nurse today. Can I get your full name and date of birth? Okay, Mrs. Bell. Mrs. Bell, do you have any allergies to anything? Okay. Well, Mrs. Bell, I understand that it's been 5 days since your last bowel movement. Is that right? How often do you have your bowel movements at home? She tells me that it's been 5 days. She usually has a bowel movement every other day at the latest, okay? So that's out of her pattern. Okay, well, Mrs. Bell, we have notified the doctor because you have, you're not feeling quite well, you're distended, you feel full, and so the doctor has ordered a tap water enema. Have you ever had an enema before? Okay. Well, we're just going to use regular tap water. We'll insert that tube into your anus and up into your rectum and put that water in there. We like for you to hold it as long as possible, at least 10 minutes. And then hopefully that will help you to go to the restroom and have a bowel movement. Do you have any questions? Okay, is it okay if we start with the procedure? Okay, well, I'm going to turn on this light if it's okay with you. And I'm going to go ahead and bring the bed up to my level. And I'm probably going to need the assistance of somebody who doesn't mind being on camera to hold the mannequin on its side. So I've got the patient up this way. I assure privacy. I assure that the room is a good temperature, that the patient won't get chilled, because we will have to expose their backside. And I'm going to go ahead and get my enema ready, okay? The first thing I'm going to do is I'm going to go ahead, before I put on my PPE, and I'm going to fill up the enema bag. Now you guys, if you've already put on your PPE, it's not a big thing. You'll just have to kind of pull your glove back so that you can feel the temperature. You do not want the temperature to be cold because it will cause cramping, will cause the patient's core body temperature to come down, but you don't want it to be hot because it could damage the tissue. So you just want to fill it like you would a baby bottle, you know, just dropping it on your wrist. You'd feel that it was warm to the touch, but not hot, okay? You can see on here, it depends on your facility. Some enemas are given via the bucket, and some of them are given with a bag like this. This bag has markings on it. Here is 500 milliliters. Here's 1,000 milliliters. So we've got an order for 750. We'll fill it to right here, okay? So I'm going to go ahead, check my water temperature, and fill the bag up. I have it clamped off when I'm filling the bag up. Once I get the bag filled, then I will go ahead and take off the cap. You guys never forget to take off the cap. And I will flush the air through the tube. You don't want to put that air into the patient's stomach or into the rectum, because it will cause them discomfort, okay? And like I said, make sure you remove the cap from the tube. You guys, there's usually lubricant in these caps, but it usually is not sufficient to make it comfortable for the patient. So what you want to make sure that you do is to take the cap off and go ahead and lubricate that tube. And you want to lubricate it about 3 inches, okay? 3 to 4 inches, because that's how far you're going to insert it. So I would use a water-soluble lubricant. Here I'm going to use what's good for the mannequin, and I'm going to go ahead and lubricate the tube. Okay, and then I can kind of put the cap back on. Make sure you take the cap off when you are inserting this into the patient, because they can come off in the patient and cause physical damage. So make sure you remember to take the cap off. Now I've got it clamped, I've got all of this ready. I'm going to go ahead and get on my PPE in the correct order. So the correct order for PPE, and you will verbalize this to your care group leader, is my gown, and you want to make sure that it's securely tied so that the gown doesn't fall down. Then after the gown, you're going to put on your face mask. And then your goggles. And last but not least, you're going to go ahead and put on your gloves. Now you're going to go ahead and turn the patient. Can I get somebody just to help me with the mannequin? You want your patient to turn to the left side, following the natural flow of the valve. So we're going to turn the patient gently, or have them turn on their left side. The lower leg, we may flex just a little bit. The top leg, though, we want to flex pretty good, like that, okay? And so now we want to take our towel, place the towel up underneath the patient's buttocks, and then we're ready to get started. When we insert this, we will tell the patient that we're going to insert it. We want to insert it aiming towards the umbilicus, okay? And then we're going to hold our bag, depending on what type of enema we want to give. If we want to give a low enema, then we're going to hold it just 3 inches above the insertion at the rectum, or the anus. If we want to give a regular enema like the one today, you would hold it about 12 inches above that insertion. If you wanted to give a high enema, you would hold it 18 inches. Remember that the higher you hold it, the faster the flow is going to be out of the enema bag. So I'm going to expose you right here, Mrs. Bell. We're going to go ahead and take the cap off, and just keep breathing. I'm going to insert, and I'm going to insert 3 to 4 inches. Okay? Holding on to that, I'm going to unclamp it, and then I will raise it. Mrs. Bell, you doing okay? I will check on my patient frequently if she starts to complain of cramping, or if she starts to complain of discomfort. Then I can either pinch the tubing right here, or I can lower this. You always want to maintain a good grip on the tube, because if not, the patient's sphincter will push out the tube. Okay, once it's in, then I can go ahead. I'm just going to remove the tube, Mrs. Bell. Take this off. And then turn the patient back over on her back. Now, Mrs. Bell, I'm going to let you hold that for just a little while. I want you to hold it as long as you can, but at least for 10 minutes. Before I did this, I forgot to say to y'all that before I did this, I would assess the patient to make sure they could get up and go to the bathroom on their own. I always stay with my patient after I've done an enema so that I can assist them to the bathroom, because sometimes it's a pretty urgent thing to get them up. I also assess to make sure that they'll be able to make it to the bathroom. If they have poor sphincter control, you can ask them questions like, do you ever have any type of accident when you need to have a bowel movement? When you get the urge to have a bowel movement, do you have to go right then, or are you able to hold it? That will give you an idea of how the patient's external sphincter control is, okay? When you assist the patient to the restroom, you won't want to flush the toilet. You'll want to tell them, don't flush the toilet. I need to see the results. And you will record the results, the COCA of the stool. So let's say that we assisted Mrs. Bell up to the bathroom and she had a firm brown stool. There was no blood, there was no black tar looking substance. And so it was a normal, just firm bowel movement, okay, with some liquid. And that's what you would record, okay? Once that's done, then you can go ahead and remove your PPE in the correct order. Gloves, hand hygiene, goggles, gown, and then face mask, and then hand hygiene. And then it's time to teach Mrs. Bell what you want her to know about keeping regular bowel movements. Mrs. Bell, you did well, and just wanted to let you know a few things. First of all, if you go longer than 3 days without a bowel movement, you need to let us know or let your physician know. You are taking hydrocodone, you're not up moving as much as you normally would, and so you will be at a higher risk for constipation. So don't go more than 3 days without letting the doctors or the nurses or someone know, okay? To help prevent constipation, you can increase your fluids, you can increase the fiber in your diet. Things that have a lot of fiber would be your bran cereals, your whole grain cereals, fresh fruits and vegetables, okay? And then I know that you've had a hip replacement, but doing range of motion, getting up to the chair, walking to and from the bathroom, doing your physical therapy, all of those things will help you to get the activity that you need, okay? Do you have any questions? Okay. And then I would go ahead and lower the bed. Call light within reach. Side rails up ×2, and the bed in low and locked position. Any questions? Does anybody have any questions about the enema? Okay. When I tell a patient to increase fluids, I do that as long as that patient doesn't have something like congestive heart failure where they're on a fluid restriction, or renal failure where they might be on a fluid restriction, okay? You have to make sure that there's no comorbidities that would cause them to not be able to increase their fluids, okay? All right, so let's move on to the TED hose. So once again, you have to have a doctor's order for TED hose. We verify that. We've got an order for bilateral thigh-high TED hose. And so what I'm going to need for that is I'm going to need to get measurements first. So we want to make sure that our patient, once we verify that we've got the right patient, can I get your name and date of birth? And she tells me, do you have any allergies? No allergies. Then I'm going to assess my patient. I want to assess and make sure that the patient has been laying in bed and had their feet up. They haven't had their feet dangling like sitting in a chair or been up walking around. They need to have been laying in bed for at least 15 minutes. Mrs. Bell, my name is Angie. I'm going to be your nurse today. And the doctor has given us an order to go ahead and put these compression stockings or what we call TED hose on. These are to help you reduce the chances of getting a blood clot. You're not moving around as much as you normally do, and so we're going to go ahead and put these hose on you as the doctor ordered, and they will kind of squeeze on your legs and help that blood to return back up to your heart and increase your blood flow in your legs, and hopefully that will reduce the chances of developing a blood clot. Have you been laying in bed for at least 15 minutes? Okay. Is it okay if I go ahead and measure you then? Okay. You guys, we want to make sure that we get a good measurement. If the TED hose are too tight, then they do just exactly the opposite of what we want them to do. They will constrict the blood flow and cause problems for our patient, okay? And maybe increase the risk of a blood clot instead of decreasing. Also, if they're too large, they won't do a good job, okay? So we want to make sure that we get the right size. So I'm going to get my tape measure out. Mrs. Bell, I'm going to have to expose your leg here, but I'll keep you covered every place else. And I'm going to measure, and I want to do my first measurement, I want to do the length. So to measure for the length, you want to measure from the gluteal fold. And if you guys don't know where the gluteal fold is on your patient, you can locate your own gluteal fold by bending your leg backwards and feel where your leg kind of attaches to your buttock, where that crease is. So on the mannequins, it's real easy, and so you just kind of hold on to that tape measure, and then you measure right here, and the measurement I get is 29. So I can write that down, 29 inches in length. And then I want to measure the thigh at the largest circumference and the calf at the largest circumference. So I want to measure around. Here on the thigh, the measurement is 20. Here on the calf at the widest spot is 13. So my measurements are 29, 13, and 20, okay? And so now I want to get out my sheet, and you guys will have to show this to your care group leaders when you're testing off, and you can see the chart here. On this chart, you can see that it has calf circumference on one side and length on the bottom. The calf circumference, do y'all remember what it was? 13. Okay, and so 12 is right here, so it's going to be right above the 12. 12 is on this line between small and medium. 13 is just right above that, so it's going to be a medium, okay? And then we measured right at 29, which is right on the line right here. And so it's going to be on the line between medium short and medium regular. Which way do you think we want to go? Do you think we want to go down to the medium short or up to the medium regular? Up to the medium regular, because remember, it's more detrimental to put on TED hose that are too tight than it is some that might be a little larger, okay? So we know that we want the medium regular, but we took 3 measurements. And the reason that we measured the thigh is because we are measuring for thigh-high TED hose. If the patient's thigh was greater than 25 inches, and it says that right here, if the measurement was greater than 25 inches, it would not be appropriate to put thigh-high TED hose on Mrs. Bell. What would we do in that case? We'd call the doctor and get an order, hopefully, for knee-high TED hose, okay? But we can't just change that. We have to call the doctor, okay? All right, so I've got the right size of TED hose now. and we're going to go ahead and put the TED hose on. One last assessment we're going to do before we put the TED hose on is we're going to examine the patient's legs to make sure that there's no skin breakdown, there's no lesions, any sores or wounds, okay? She doesn't have any. If there was, we'd probably want to notify the doctor, okay? Well, we would want to notify the doctor. So now we're ready to put the TED hose on. We want to get it in exactly the way that we're going to put it on the patient. And so the way that we can do that is we can pretend that our arm is the patient's leg. And we want to put the TED hose on our arm the same way that it would be on the patient's leg. So this would be the patient's thigh, calf, and then my hand would be the foot. So notice the pad right here. We want that to the inner thigh. We want the seam to face outward. How many of y'all have ever worn a pair of jeans and they were too tight and the seam cut into you? You can see how that can cause skin breakdown, especially for a patient that's compromised in bed, not moving around. So this seam has to go with the seam to the outside, okay? The pad to the inner thigh, the seam to the outside, and we put it on our arm, and we want to put the heel on the palm of our hand with the heel just below the heel of our hand, where we can kind of make a sock puppet. And then we're going to invert the TED hose all the way, holding on to the TED hose like this. Then we're going to take our fingers and spread the toe part open, and we're going to go ahead and put this over our patient's toes. So we've spread that green line that was the toe part open, and now we're going to take the rest of the TED hose and kind of put it on the patient's foot. And it's a little snug, but we're going to sink that heel right up over the patient's heel here. When we have that on there, then I'm going to come down to the end of the bed and I'm going to gather this stocking. I'm going to gather the stocking, making sure that I keep the pad to the inner thigh. And I'm going to gather this stocking and push it over the patient's foot. Now I have it gathered up and over the patient's foot, I can start ungathering it and pulling the stocking upward. Just gently do this. Be patient. You don't have to hurry it up. Remember that if this patient had surgery on their legs, that would be very painful every time you pulled it up. So you would want to be very gentle, okay? I've seen people today bend up the knees and push real hard, and you don't have to do that. You can just work with it to get all the wrinkles out. You want to get all the wrinkles out because if you don't get the wrinkles out, they act like small rubber bands that you've put around your patient's extremity. Now you can see I've got this over the toes. If it stays right there, it's going to cut off the circulation to the toes. And the heel's way up here. So I want to go ahead and adjust the patient's heels on the stocking to where it's down over the patient's heel. And now I can pull the stocking up where it's supposed to be. Y'all see where the heel's supposed to be? Now it's in the right place. The toes are covered. And I'll show you why those toes are open in just a minute. And we're going to go ahead and slide the stocking on up onto the patient's leg. And we'll just keep working with it until we get it smoothed out, the wrinkles out. Now, you guys, the way this should look, the pad is to the inner thigh, the seam is on the outside, and there are no wrinkles, okay? And that's how you want it to look when you finish, okay? If during the demonstration you get finished and you notice that the seam is to the inside, don't tell your care group leader you're ready. Say, oh, you know what, that's to the inside, I need to redo this. And go ahead and redo it, okay? So there's no wrinkles, the seam is to the outside, the pad is on the inner thigh, everything looks good. So now I'm going to reassess my patient or do evaluation. And I would do this on both legs. I would put the hose on both legs, okay? We're just showing one. Mrs. Bell, is that tight or painful? It should be snug, but it shouldn't cause any pain for you. Okay, it is snug. Okay, I'm going to go ahead now at this point, and I'm going to check for good circulation. I'm going to look and do a bilateral comparison. I'm going to look at the color of the toes. I'm going to feel the temperature of the toes. It should be warm, okay? Some patients will have colder feet, but it should be about the same on both sides. And then I'm going to check what we call capillary refill. You guys take your thumb. You can check this on your thumb just as we would on the patient's toenails. If the patient has fingernail polish, you can check it on the bottom of the toe. Okay? But take your thumb and push really hard on your nail bed and then let go. It should turn back pink. It should blanch white while you're pushing, and then when you let go, it should turn back pink within 3 seconds. If it takes longer than 3 seconds, then that circulation is impaired, okay? So you want to do a bilateral comparison with capillary refill, and then you also want to palpate the pedal pulses, okay? Remember that a pulse is felt over a bony prominence, where the vessel comes up over the bony prominence. And so in the feet, what you can do is you can come up between the toes right here and go up over that bony prominence, and I use 3 fingers and I just lay them across the patient's foot right there. You don't want to press too hard or you'll obliterate the pulse, but you do need to press a little bit so you can feel. And you want to do this at the same time, doing a bilateral comparison. And I feel that the pulses are strong and equal. And so my patient's circulation is good. So now I can pull the TED hose back down so that we continue with good, strong circulation. Okay? All right, Mrs. Bell, all that's left is for me to tell you how to care for these TED hose. You probably will take these home, Mrs. Bell, and so some things I need you to remember. Number 1 is that they need to be removed at least once a day for 30 minutes, okay? A good time to do that is when you get up and get cleaned up, take a shower, sponge off, or whatever. Take them off for 30 minutes. If they become soiled, they need to be hand washed in a mild soap and water, rinse well, and then hung up to air dry. We don't want you to put them in the dryer because that ruins the elastic in the hose and they won't work, okay? These hoses are very slick on the bottom. So when you're getting up here and then when you're getting up at home, make sure that you have some type of loose fitting slipper or house shoe or socks with the rubber soles on them. But we don't want those shoes or socks to be tight. We want to avoid any tight-fitting socks or shoes. Do you have any questions? Okay, all right, good deal. Is there anything else I can get for you? And so my patient has verbalized understanding. I'm going to leave her in a safe position. Bed low and locked, side rails up ×2, the call light within reach. I'm going to turn off this big, huge light, do hand hygiene, and go out and document. And you guys can read your documentation there on your scenario or your case study, okay?